What are the main challenges in treating TB-HIV co-infection? When we look at the challenges faced in treating tuberculosis in people living with HIV, we find a complex web of issues. One major challenge is the weakened immune system caused by HIV. This makes individuals more vulnerable to active TB disease. Because of this, TB can progress rapidly and may not show typical symptoms, complicating both diagnosis and treatment. Diagnosis itself can be tricky. In those who are HIV-positive, TB symptoms can be less clear, and standard tests may not work as well. This can lead to delays in detecting TB, which can worsen health outcomes. Another significant hurdle is the interaction between treatments for TB and HIV. When treating both conditions, healthcare providers must be cautious about potential drug interactions. For instance, rifampicin, a key medication for TB, can interfere with certain antiretroviral drugs used for HIV. This means that doctors often need to adjust dosages or choose different medications, which requires specialized knowledge. Adherence to treatment is also a challenge. Patients with TB-HIV co-infection often have to take multiple medications that come with varying schedules and side effects. This complexity can lead to issues with sticking to the treatment plan, increasing the risk of treatment failure and drug resistance. There is also the risk of immune reconstitution inflammatory syndrome, or IRIS. This occurs when starting HIV treatment in someone with active TB, leading to a temporary worsening of TB symptoms. Managing IRIS requires careful timing of treatments to avoid complications. Multidrug-resistant tuberculosis presents an additional challenge. This form of TB does not respond to standard medications, making treatment longer and more difficult. Access to preventive therapy is crucial. Providing effective TB preventive treatment alongside HIV care can significantly reduce TB cases. However, many healthcare systems, especially in high-burden areas, struggle with limited resources and fragmented services. Finally, monitoring and managing side effects from both TB and HIV medications is essential. These treatments can cause significant side effects that need careful oversight, which can be resource-intensive. In summary, treating TB-HIV co-infection involves navigating weakened immunity, diagnostic challenges, drug interactions, adherence issues, the risk of IRIS, drug resistance, and limitations in healthcare systems. Addressing these challenges requires coordinated care, individualized treatment plans, and strong health infrastructure to improve outcomes for those affected. Always consult healthcare professionals for personalized advice and treatment options.